Hello, I'm Frederik Barkhof. I'm a neuroradiologist, and my daily routine is to perform MRI scans in people suspected of having diseases in the brain, including dementia and Alzheimer's disease, where we can recognize various features of neurodegeneration and vascular pathology that may adversely affect their brain function and help us to diagnose, on the one hand, Alzheimer's disease as early as possible, but on the other hand, to try to understand the mechanisms of disease progression, heterogeneity of the disease, and side effects that may occur if you administer certain drugs, and specifically an interesting thing called ARIA, which stands for amyloid-related imaging abnormalities, which can only be discerned on MRI scans of the brain. Amyloid-related imaging abnormalities, or ARIA, is a very descriptive term. Suggests that there are findings on the MR related to amyloid. In fact, it's a bit of a misnomer. I think it should be called amyloid treatment-related imaging abnormalities, so ARIA, because there are various things related to amyloid that we can already discern on brain MRI scans without having such treatment. And a very good example of that is the cerebral microbleeds due to hemosiderosis. So that's part of the ARIA spectrum, where you have ARIA-H. This occurs naturally in patients with Alzheimer's disease and only gets aggravated when you apply these drugs that remove the amyloid from the brain tissue and probably transport it along the vessel walls and then induce further microbleeds around vessels in the brain parenchyma. The interesting thing is that we were already aware of amyloid-related imaging abnormalities. There's a disease called cerebral amyloid angiopathy, which is related to Alzheimer's disease in the sense that there's also abnormal amyloid in the brain, but not so much in the parenchyma, but more in the vessel walls. And we know that people with cerebral amyloid angiopathy may have small microbleeds that we can see on the T2 star images on MR. But very interestingly, the rare phenomenon, they may develop a sort of inflammatory response to this amyloid, and then they develop a high signal on a different type of image, a so-called flare image. And in fact, these two abnormalities are the same sort of abnormalities that we find in ARIA being induced by these drugs. ARIA comes in two different manifestations. One is called ARIA-H and one is called ARIA-E. And the H stands for hemosiderin, and hemosiderin you can detect with a specific MR technique, which is called the T2 star technique, which brings out a susceptibility effect caused by the magnetic effect of certain types of iron. So you see dark spots, which we call microbleeds, or you can also see leakage of blood products on the surface of the brain, which we call superficial siderosis. So that's the ARIA-H. On the other hand, you have the ARIA-E phenomenon, and the E stands for edema or effusion. And those you recognize on a different type of MR sequences, pulse sequences, called flare images. And that's a type of image where you try to get very low signal in the CSF, which is the fluid around the brain. And with ARIA, there's leakage of proteins into this fluid, and then it becomes very bright. And this can happen either in the brain parenchyma itself, then it's called edema, or it can happen in the CSF spaces around the brain, so in the sulci, and then it's called an effusion. So E can stand for edema, can stand for effusion, and both are recognized on flare images. ARIA-E and ARIA-H can occur in isolation. There tends to be a co-occurrence, so a patient, for example, with ARIA-H may be more likely to develop ARIA-E, but there are definitely ARIA-H phenomena, for example, occurrence of a new microbleed that may happen without any edema or effusion. Conversely, people can have effusions or edema without new microbleeds or siderosis. But there is also definitely some co-occurrence, also because it's a shared pathological phenomenon, but it's not a simple one-to-one mechanism. ARIA-H has a very specific definition. So, as I said, there can be either this low signal around the surface of the brain, the superficial siderosis, which you can recognize as a sort of line outlining the parenchyma, or sometimes if it's on both sides of the sulcus, can be a tram line type of phenomenon. The microbleeds are defined as things between 3 millimeters and 10 millimeters. And that is slightly artificial, but you have to define microbleed. If it's bigger than 10 millimeter, we call it a macroscopic bleeding, so a macro bleed. And this may occur in other diseases. For example, if people with stroke or using antiplatelet therapy, they may have macroscopic bleeding. And usually you would recognize that on other images than the T2 star images as well. So the microbleed is very strictly defined as something smaller than 10 millimeters and best recognized on the T2 star image and not on a regular T2 image. Because of the specific nature of that type of images, it will bring out really small deposits of iron. And in fact, we think they're between 3 and 10 millimeters, but if you would find them under the microscope, they're actually perhaps 0.1 to 2 millimeters. But these specific MR techniques makes the susceptibility effect bloom, and they appear slightly bigger than they are in reality.